Hey, my name is Anmol, and today I'm back with an interesting topic, AI in healthcare. But let me first tell you why I'm creating this video. I've been creating videos across multiple topics, text messaging, voice over IP in healthcare, but today is a different video, right? And I'm talking about AI. But before I do that, let me quickly tell you a little bit about myself. I'm the co-founder and CEO of Emitter, an AI company built for healthcare businesses. We work with over 1,000 plus healthcare businesses and healthcare practices in the US. And I've had many of our customers coming to me and asking, hey Anmol, what is AI all about? Right? How can it help us? Will it automate a receptionist's job? Will it automate a doctor's or provider's job? Will it take away jobs? Is it good for the future? So on and so forth, right? So while there is excitement, there is also fear and uncertainty. And with this video, I will try and cover some of those. While I will humbly accept that I'm no expert at AI, but I definitely believe that I'm one of the best persons to talk about a healthcare business and maybe where AI can help healthcare businesses, because I've been the closest to understanding what a healthcare practice goes through every day. The struggles, the phone calls, no-shows, patient tardiness, patient experience, so on and so forth. So in this video, I'm going to talk about a couple of things, right? What is AI? Biggest areas where AI can help in healthcare. Why companies trying to replace receptionists in the healthcare domain with AI is a disastrous idea, not even a bad idea, it's a disaster, right? And the future of AI in healthcare. So I'm going to try and keep it as objective as possible. I'm not going to give you any top level theories or make any opinions as much as possible, right? So let's get it straight. What is AI? In very simple terms, AI or artificial intelligence is like teaching a computer to think and, make decisions somewhat like a human. It's when we give machines the ability to learn from the past information, recognize patterns, and solve problems without needing to be told exactly what needs to be done, right? It's very similar to how humans sort of become intelligent over time. We take years, and since AI is a machine, it doesn't get tired. You can feed all of that information into the machine at once, and it can become as good as a human into taking decisions, right? A great example of AI solving something that humans used to handle in healthcare is, for example, AI-powered medical diagnosis. Specifically, let's say detecting diseases like cancer from medical scans, X-rays, MRIs, CT scans, etc. Right? Now, let's try and understand that a little better. So how was it done before? Previously, doctors or radiologists would examine scans manually to look for signs of diseases like lung cancers or if there's a sign of a tumor. Now, this required years of training, deep concentration, and sometimes even the best doctors would miss out on early signs of a disease, right? In my case, for example, I know from my dad's illness, he was a cancer patient. He was visiting the hospital for 4 continuous years, but nobody was able to detect it, right? So even the best doctors could miss it. Now, with AI coming in, AI can be trained on millions and millions of medical images and learn to spot patterns with high, even maybe 99 or 100% accuracy to indicate if the disease exists even in the early stages, right? Which might be just too subtle for the human eyes. So the AI can scan through thousands of images in seconds, unlike humans who will probably take time. So it's not a bad thing that humans are doing. I'm just saying that AI can do this faster and give time to humans to focus on something else, more on patient experience, etc. Right? So that's something where AI can help. Now, why is, and this is just an example of what AI is. Now, why is this a big deal, right? It's really a big deal because it leads to much faster diagnosis, right? AI can analyze images instantly, helping doctors make decisions quicker. So we don't mean to say AI will replace the doctors, but it'll help in faster decision making. And that's what AI is doing today with everybody, right? It has much higher accuracy. AI reduces human error and catches things that might be overlooked. I can tell you from my own example today, a lot of the things that we used to do in our own team manually and had errors, systems can do this because they are pattern based and there's no error at all. There's no room for error, right? And most importantly, it helps with doctor shortages. Instead of relying on few specialists, few nurses, or a few receptionists, AI can assist in screening patients even in places with fewer doctors. So again, the point here is that we're not saying that if you had 10 doctors or 10 providers, you should have 5. We're saying that there is already a big shortage of healthcare staff or healthcare workers in the United States, and AI should come in and fulfill that gap. And that's exactly why I was saying that if you're trying to replace healthcare workers with AI, it's a recipe for disaster because there's already a big shortage. And that's what I'm going to talk about in the next point. Now, before we talk a little bit about AI, we should first take a step back and see what are the areas which need the most attention to improve healthcare and access to healthcare in the United States. So if you look at the data, today, and this is where I'm talking opinions. If you look at the data today, there's a shortfall of 15 million healthcare workers across the globe, right? Now, this leads to three massive problems. One is there's poor access to healthcare. We all know in United States, trying to get access to doctors, especially things like elective care, it has a long waiting line, right? I remember from my own experience, a relative of mine needed a dermatology appointment, and the doctor said that, hey, you can come after 6 months. And he was like, hey, are you crazy? But that's what it is today, right? Because of shortage of healthcare staff. And because there's a shortage, it leads to a lot of burnout of staff, right? Which leads to high churn. So you've got to keep releasing, you've got to keep replacing staff. And I'm sure right now all of the healthcare people, healthcare providers are laughing, right? Because this is exactly what happens. I'll give you an example. One of our customers, they've been working with us for the last 3 years. And I was looking at the data of the number of receptionists and nurses that came in and went out from that practice. Interestingly, they had 82 people they added to our system and also deleted them over a course of 3 years, right? So data suggests that there's 100% turnover in a 5-year period. So that's the second problem. And of course, it leads to, there's bad access, there's burnout, but most importantly, it leads to late detection of health issues, which is what I gave you the example of, right? Hence, I think AI should not be used to replace. If somebody's trying to do that, or if you're looking at AI and trying to replace receptionists, it's a bad idea, right? But it should try and fulfill the gap of healthcare staff. And those are the use cases I'm going to be talking about next. Now, let's talk a little bit about AI in healthcare and what are the areas it can create efficiencies, right? And areas where it probably cannot. Now that we understand AI can potentially create efficiencies and automate anything where there's a pattern, however complicated it might be, let's understand this with a couple of examples. If your nursing staff is making, let's say, 50 outreach calls to patient after, post their treatment, and they tend to ask the same set of questions, of course, there will be edge cases, and this is where AI and human have to, work together in the same loop. But if they tend to ask the same questions post-treatment, post-therapy, then it's almost like a pattern, right? It's the same kind of calls that they're making, same kind of questions that they're asking. This can be done with AI. Humans can make one call at a time. AI can potentially make 100 calls in a minute. So that's the difference, right? It can save you time, and this is where it can fulfill the current gap. Or let's say, for example, if your revenue cycle management team is entering medical codes into the EMR, or your billing team is understanding these codes after understanding the treatment that your patient went through. If this is also a pattern, then it can easily be done and much faster without any error of data with the help of AI, right? So it just helps you with faster claims and more accurate claims. So that's essentially what I would say you should think about where AI can really help you. And then, of course, we all understand that there is a lot of incoming phone calls where receptionists also take phone calls for things like appointments, rescheduling, cancellation, and those are also standard patterns. Patient asks a set of questions, receptionists give a standard set of questions, etc., right? And that's where companies like ours, Emitter, comes in and automates the end-to-end patient scheduling journey, right? So in my opinion, the future of AI in healthcare, I'm particularly positive about the future of AI in healthcare. And I believe that AI will impact three main areas in healthcare, right? One is it will impact in automating administrative tasks. To a large extent, all admin tasks should be moved to AI, and the admin teams should focus on something better. Maybe it's better patient experience or in growing the practice, so on and so forth, right? 2, it'll help in reducing staff shortage, which is a critical problem in our industry today. And 3, I think it'll help in improving the patient outcomes. As a result of area 1 and 2, it will overall help in improving the patient outcomes, right? If you found this video helpful, I'm going to be creating a lot more videos over the course of the next 60 days on AI, specifically deep diving in specific areas of AI in healthcare. So, follow our channel, and if you want to know more about how Emitter can help you with automating some of your work, then feel free to reach out to us. Thank you so much.